So, a question that comes to mind for me and the subject of people dealing with brain cancers is, why aren't we providing them with more support, like similar in line when people are diagnosed with have a concussion? So, imagine these poor people with a brain cancer diagnosis. I know the disease manifested in the brain, and tumors cause their own problems and can weaken the body. But then when you look at its management, there's surgery, they'll crack the skull, cut it out, they could radiate it, they could be given chemo pills and all the above. So, and then basically they're kind of left on their own accord, okay, just continue what you're doing and, follow up with scans and away we go. Versus when you look to the subject of concussions, I know it's different, but still there's an insult to the central nervous system, more obviously impact versus a disease in the brain. And then there's all this kind of, discussions about rehabilitations, about trying to get people back to a normal place. Look at these athletes, right? And yet, doing some gentle exercises and just to try to assist in the nervous system to recover. But yet, in the management of brain cancers, I never hear of any of that stuff. I've been doing this for 25 years. And so it's an area that I think needs attention. These poor people need help, they need support. And so it's something just more to create awareness that I think, if you're trying to help a loved one or family member with a brain cancer or post-treatment effects is, think of a concussion. That's how I look at it. And what would you do to help them and applying some of those principles?